Next slide. So the system is designed to follow this pathway. So we know that we have the vaccine manufacturers, and we see down below you have the delivery system from the feds. Department of Defense, they're responsible for Veterans Affairs, federal prisons, and then the pharmacy partnership, and that's with CVS and Walgreens. And so if you're familiar with the pharmacy partnership, their responsibility is basically they go to the long-term care facilities, the skilled nursing facilities, and they provide the vaccination to those staff and to the residents of those facilities. We have no control over that amount of vaccine that goes through this program, and that's directly a program that is developed between the eligible long-term care facilities and the SNFs in order to enroll in that program. We have 149 long-term care facilities, skilled nursing facilities that are enrolled in the program here in Stanislaus County, and we have about 7 that were eligible to enroll but didn't enroll.
What was the number again?
149 long-term care facilities and skilled nursing facilities that are enrolled in the program, and approximately 7 that were eligible to enroll but did not enroll into the program. Through the state of California, those are the multi-county entities, and again, 7 major health systems. For our county, that includes Kaiser and Sutter. They're also responsible for the state prisons and the state hospitals. And the populations that are served are those employees and clients of the NCEs and the prisons and the hospitals that are under the jurisdiction of the state of California. For local health jurisdictions, public health, pharmacies, healthcare providers, employers, and the community organizations are the delivery system that the local health jurisdiction is responsible for. And then those populations that are served are all other populations that are not covered by the feds and by the state.
As it relates to the CalVac system, essentially we have providers in the community that have stepped forward and said we would like to vaccinate, and we have given them all of the information they need to position themselves to be approved to vaccinate. They are stuck in a state database, and that state database has now been taken offline, and we haven't had access to it for days. So we're awaiting that database to come back online to confirm to us who can and cannot deliver vaccine. We cannot authorize someone to deliver vaccine in Stanislaus County. We can only position them to be approved by the state of California. And right now, there are some that are in a holding pattern. And the last thing I want to share is that as it relates to the registry, that's related to who gets to vaccinate people. As it relates to those 2 registries that you're looking at, Marianne mentioned, we do not have access to the CARE2 registry system that is being used by some of the multi-county entities. So if you were vaccinated through Kaiser or through Sutter, it is likely that we have no access to the information so that we can report to you that you were vaccinated and count them in our counts here in Stanislaus County.
It's challenging, as you've been hearing some of the changes that are taking place across the state, and now this morning hearing from the feds, the potential of changes to the tiers. And so that's been one of our main challenges within this vaccination unit. We're trying to chase a moving target. The state will make some changes to the tier status and specifically those target audiences, and then we have to scramble and change our plan, and then to come to find out, this happened last weekend where they updated the state's website, the target audience changed, and then the next day they took it down because they said it was incorrect. We established a county vaccination clinic, which, as I mentioned, is at Scenic, the old hospital, and that was open on January 5th, 2021, and the hours are Monday to Friday, 9 to 5, with regards to that. Our capacity there is 700 per day. That's what we can vaccinate per day through that Scenic location. And so can we manage 700 a day there? That's kind of that's the height that we can manage at, because it's just not functional for more than 700 people per day at that location. And so we are in the progress now. We have a site visit taking place this morning in Turlock at another location, and we are working with it's actually CSUS Stanislaus. We're working with them to develop a facility use agreement in order to expand that, hopefully for the next 6 months, to have a location in South Turlock and have a location in North Modesto, and then working on east and west of the county. So we're really trying to branch out and give an opportunity to vaccinate all throughout the county. So Stanislaus County vaccination program, the data as of January 11th, 2020, We had received 25,225 doses, and that's from the beginning of the release of vaccinations from that program. 16,215 have been allocated and distributed to community healthcare partners for Phase 1A. We have a long list of community healthcare partners. Dialysis is a healthcare partner that we release vaccinations to. Save Mart is going to be one of our healthcare partners. And some of the clinics, privately owned clinics within the county as well. So 16,000 doses were distributed to those healthcare partners. Currently, as of January 11th, 2020, we have 9,010 doses that are allocated to county public health. 1,635 doses have been administered to the public, 4,000 doses for the remainder of this week's clinic, and then 3,375 doses are available for additional distribution in the community or second dose allocations to healthcare partners. So really, when you look at those numbers, we have 3,375. That's really what's available for us if we follow that allocation process there. We have no information, as we'll beat this to death, but it needs to be heard over and over again, specifically by the community, that we have no information available on the number of doses administered by Kaiser and Sutter in Stanislaus County through the state's MCE program. And we have no information available on the number of doses administered through the federal Walgreens CVS pharmacy program in Stanislaus County in order to support those long-term care facilities, Veterans Affairs, Department of Defense, and state prisons.
As the tiers and phases currently stand, we all have to realize some people are going to get vaccinated out of order. Whether it's unintentional, it's due to this rampant confusion that's coming out of either the state or the federal government. It's simple human error, right? This involves humans doing it, right? So someone has to come in and approve things and screen. There's going to be errors, right? Our goal is to follow this to the best of our ability. But I'll go back to our primary objective. That's to get vaccine into people's arms, and we do not want to waste a single dose. Right, so if someone comes in and says, I'm an ag worker, how are we going to verify that? And our simple answer is we're going to do a self-attestation process. Right? If you come in and say that you're an ag worker, we expect you to do the right thing and not try to jump the line so that we can go through this process. There is no way without exceptional bureaucracy for us to verify all of that. And if we go through that exceptional bureaucracy, as we're seeing out of the state right now, that will slow this process down, and that does nothing to fix the COVID problem. So we're not going to do that. The JIC, the Joint Information Center, is going to be revamping a lot of what we do specifically around the vaccine side starting this week. On our dashboard, our primary dashboard, there is going to be a Vax page, and if you look at it, right, you have cases, you have hospitalizations and deaths and community, and I don't recall the exact order off the top of my head, but vaccine is going to be on there. It will probably be, I'm not the tech guy, probably be the landing page or where that starts, because right now that is going to be the single most important thing that we do. So with that, we as the EOC team, we have a few requests for really our entire community. But one, we ask all of you, echo the messaging that's coming out of the JIC so that we have a kind of a unified voice as to what's going on and where people can get information. Reach out to our state and local officials. We need expedited vaccine providers, right? We need this process that we spoke to. It needs to move faster, right? We need to get more people approved to stick those needles in people's arms. We need access to all of the data, right? I think Mary Ann or Dr. V, one of you two, covered where that information goes, right? We need access to all that so we can give you those accurate, and our community, the accurate numbers of people who have been vaccinated in this county. And finally, I'm not optimistic after 10 months of dealing with this. We need our state and federal government to give us, the people on the ground that are trying to solve this problem, advance notice of what is coming down, what changes and what major pronouncements they're going to make. That needs to be more than an hour heads up of, here's the tidal wave that's about to slam into you. So, and we would ask that you all reach out to our state and our federal partners and ask them to engage on these very processes.
The first and the anchor component are those 4 distribution centers that were mentioned. And we will stand those up as quickly as possible: Modesto, Turlock, East County, West County. So 4 basic hubs. We will bring in qualified staff to operate those hubs. And as was mentioned earlier, there's a whole list of folks that we can tap to do that. And one of the new ones is EMTs. I want to acknowledge that Dr. Wei-Shin-Payan has been making this an issue with the state of California for months now, that if we could activate the EMT workforce to support us, we'd be in a better position. Unfortunately, that didn't happen technically until just recently. So now that it's happened, and that's a good thing, we'll jump through all the administrative hoops to activate that EMT workforce to come in and support those vaccine clinics. So we're confident that we can pull in enough vaccinators in our 4 main regional clinics. In addition to that, though, we want to have as many points of distribution throughout the community as possible. Ideally, people can get vaccinated in the neighborhood that they live in, maybe with the pharmacist that they work with all the time and that they trust, maybe the community-based organization that has skilled individuals to do it, that they trust at the neighborhood level. So that's ideal. So we're working on both at the same exact time. And unfortunately, some of the way that this has been structured at the state level, or some of the, veiled threats about licensure, really water down our ability to work on that second component of neighborhood-based vaccination points. We call them pods, points of dispensing.
Going back to the number of doses that are administered by Kaiser and the other MC entity programs, have we tried reaching out to them to see if there's information available that we could use?
So yes, I've reached out to Sutter, and they're working to get me some preliminary numbers. Kaiser said they have submitted it to Healthy Futures, so I've reached out to Healthy Futures to find out where the data are and what the block is there with receiving it. So I'm not sure about that one. We do a lot of work to make sure that no dose has gone to waste, and so they get redistributed. You can open it up to the next tier, so if you have someone you can vaccinate who's the next tier, go ahead and vaccinate. Otherwise, there is redistribution, and we have done that nearly daily, it seems like. It's probably not, but it feels like we're doing it all the time. And as far as we're aware, not a single dose has gone to waste in this county. Nobody has reported a wasted dose. It's really, I have to express frustration with this. It's very frustrating. The allocation process isn't ours. We're not getting enough to finish 1A when they're telling us we should be done. And then we're begging for more doses to be able to do so. So it's very frustrating.
Going back to the EMTs and paramedics and getting them ready to start administering the vaccine, has training already been set up for that? So when we have the vaccines ready and we start branching out, do we have that staff ready to go?
From the report from Mountain Valley EMS Agency is it's about a 2 to 3 hour online training that they have access to, and they're supposed to be starting that this week. For the county, we have approximately 1,100 EMTs that are certified, and probably half that amount for paramedics, so 500 to 600 licensed paramedics in the county. And so we've been working with the EMS agency in order to branch out to make sure we can use as many of those resources as we can. So we're hoping that will be completed by this week, or at least started this week, so we can take those numbers and start sending out a blast email and having contact with those first responders, EMTs and paramedics, in order to utilize for these pods that we're looking at doing in the county.